something that you've done for over 25 years as a suicide interventionalist. In moments like that, the stake, I would say, is the highest because you're literally intentional in trying to save someone's life. If you fail as a psychologist, as a specialist, then they could take their life. And then you being successful without losing any kind of life. I'm curious to know your point of view. When someone are going through that dark night of the soul where they lost all hope, all humanity of themselves, the environment, just the point of living, right? All of that gone. They don't have anything to stand on. How do you persuade them in recontextualize such that they have that basic safety, basic, psychological safety to stay alive?
So after Anthony Bourdain killed himself,
mm-hmm.
I wrote a blog. You can find it. Why People Kill Themselves. It's Not Depression. So it got 500,000 views in a week because it's a strange title. And what I talked about is there's hundreds of millions of people that are depressed who don't kill themselves.
Mm-hmm.
Hundreds of millions of people lose jobs, lose marriages. They don't kill themselves. It
mm-hmm.
may contribute to it. But as a suicide prevention expert, one of the things I've observed that almost all of them have in common when they kill themselves is they have despair. And if you break the word despair into DESPAIR, it means despair, unpaired, hopeless, without a future, powerless, without the power to get yourself out of it, helpless, worthless, useless, meaningless, purposeless.
Mm-hmm.
And when they all line up, the last one is pointless.
Mm-hmm.
And you pair with death to take the pain away.
Mm-hmm. It's an easier path to...
It takes the pain away.
Reset, correct.
So what I learned to do, and I was so fortunate, is after I trained in psychiatry, I didn't go work for an institution. I was going to, but then it was a fellowship and it fell through. So I said, let me just put out my shingle. And one of my mentors was the pioneer in the field of suicide prevention. So he kept referring me suicidal patients.
Mm.
And so I was fortunate because, see, if I worked in an institution, I would have to hold my clipboard between them and me. And I'd say, how's your sleep? How's your medicine? Have you had any of those suicidal thoughts? But because I'd have to report it to someone. But what I started to realize is I started to look into their eyes. And what their eyes were telling me is, you're checking boxes and I'm running out of time.
Mm.
So I had a choice. Stop checking the boxes and see what I was seeing in their eyes and dive in. So my view of this despair, it's like an abscess, like a wound, a mental wound in the dark night of the soul. And if you know anything about wounds, you need to go in, you clean it out, and you don't sew up the wound. If you sew it up, it may get reinfected, may get septic.
Mm-hmm. Mm-hmm.
What you do is you go in and you clean it out, you leave a drain in, and it heals from the inside out. We call that granulation. So what I learned to do was go into the dark night of the soul and just stay with them there. Didn't throw treatments or advice at them because many of these were multiple attempters. And I would just find a way to listen into their eyes, and I would go into the dark night of the soul, and I'd keep them company there.
Mm.
And when they felt by me,
mm-hmm.
which is different than feeling understood is nice, it's better than feeling misunderstood.
Mm-hmm.
But when you feel felt, when you feel that your pain is worth someone getting there right next to you so you're not alone in it, people start to cry. They cry with relief. And now, if you're just learning how to do this, and I have a new book coming out called Why Cope When You Can Heal, Healthcare Heroes of COVID-19 Can Recover from PTSD.
Mm-hmm.
It's coming out in the next couple of months. And we introduce something called surgical empathy.
I like that.
And surgical empathy is literally going into where it hurts most in the dark night of the soul and not rushing them with a technique. So with the multiple suicide attempters that I'd seen, they'd already had all the techniques. And again, if you're depressed, you're suicidal, and I'm not currently in practice. I'm retired, although I'm teaching counselors, teaching parents. I was the co-creator and moderator of a multi-award honored documentary called Stay Alive, intimate conversation about suicide prevention, where I speak to Kevin Hines. He's the fellow who jumped off the Golden Gate Bridge and survived.
Mm.
And you can get it for free, stayalivevideo.com. And so the whole idea is that when you can listen in to the dark night of the soul and people feel felt by you, they start to cry. And as they start to cry with relief, they start to calm down. Now, for you techies, I'll give you a neuroscientific explanation for that. When people are really stressed or distressed, something in your brain called your pituitary sends a signal to your adrenal glands, and your adrenal glands push out cortisol. And high cortisol is basically a signal to your physical body, let's get ready to deal with this stress. And that high cortisol then goes back and triggers a part of your brain called your amygdala. And the amygdala is in your emotional brain. And what happens is it sends a signal to your amygdala, let's redirect the blood away from thinking to surviving.
Mm-hmm.
So blood preferentially goes away from your thinking upper human brain to your survival lower brain, because in our primitive thing, we needed that lower brain because we had to get the heck out of there. We had to run. We had to flee, fight, or freeze.
Mm-hmm.
And what's interesting is what counteracts high cortisol is high oxytocin. Oxytocin is the bonding hormone, and it's what enables young mothers to bond with their screaming babies. Screaming babies are stressing them out, they're sleep deprived, but there is so much oxytocin going on that they're bonding to that baby, and they don't get angry, they get tired. And so when you cause someone to feel felt, they get a surge of oxytocin. The oxytocin counteracts, the cortisol goes down, the amygdala goes down, blood flow goes back up into your upper brain. You can start to think again.